Atenolol is a medication used to treat high blood pressure and chest pain. It can also help improve survival after a heart attack. Atenolol belongs to a class of drugs called beta blockers, which work by blocking certain natural chemicals in the body to lower heart rate, blood pressure, and strain on the heart. When taking Tenormin, make sure to follow your doctor's instructions. You can take it with or without food, usually 1 to 2 times a day. But be careful with apple and orange juice, as they can affect how your body absorbs the medication. It's best to avoid these juices within 4 hours of taking Tenormin unless your doctor or pharmacist says it's okay. The dosage will depend on your medical condition and how you respond to the treatment. Take the medication regularly to get the most benefit from it. Even if you feel fine, keep taking it. Many people with high blood pressure don't feel sick. If you're using Tenormin for chest pain, remember that it needs to be taken regularly to be effective. Don't use it to treat chest pain when it happens. Follow your doctor's instructions for using other medications to relieve chest pain. It might take 1 to 2 weeks before you feel the full benefit of the medication. If your condition doesn't improve or gets worse, like if your blood pressure stays high or increases, or if you have chest pain more often, be sure to tell your doctor. Side effects of Tenormin may include dizziness, lightheadedness, tiredness, and nausea. If you experience any of these, make sure to tell your doctor or pharmacist right away. To reduce the risk of dizziness, be sure to get up slowly from a sitting or lying position. This medication may also reduce blood flow to your hands and feet, making them feel cold, especially if you smoke. It's important to dress warmly and avoid tobacco use. Remember, your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. However, be sure to tell your doctor right away if you experience serious side effects, such as new or worsening symptoms of heart failure, very slow heartbeat, severe dizziness, fainting, trouble breathing, blue fingers or toes, or mental/mood changes. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. And if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada. If you're taking Tenormin, don't stop taking it suddenly without talking to your doctor first. Some conditions can get worse if you stop this medication abruptly. Some people have experienced chest pain, heart attack, and irregular heartbeat when they suddenly stop taking similar drugs. If your doctor decides you should stop taking Tenormin, they may tell you to gradually decrease your dose over 1 to 2 weeks. When you're gradually stopping this medication, it's a good idea to limit your physical activity for a little while to reduce strain on your heart. If you experience chest pain, pressure, or tightness, or if the pain spreads to your jaw, neck, or arm, or if you have unusual sweating, trouble breathing, or a fast or irregular heartbeat, get medical help right away. Before taking Tenormin, it's important to tell your doctor or pharmacist if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to tell your doctor or pharmacist about your medical history, especially if you have certain heart rhythm problems, breathing problems, blood circulation problems, kidney disease, heart failure, serious allergic reactions, or a certain muscle disease. Tenormin may make you dizzy, so it's important to avoid alcohol or marijuana, as they can make you more dizzy. It's also important to talk to your doctor if you are using marijuana. Before having surgery, it's important to inform your doctor or dentist about all the products you use. Tenormin may also affect how you feel the fast or pounding heartbeat when your blood sugar level falls too low, and may make it harder to control your blood sugar levels if you have diabetes. If you are pregnant or planning to become pregnant, you should not use Tenormin, as it may harm an unborn baby. This medication also passes into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. Remember, it's important to be aware of how Tenormin may interact with other drugs you may be taking. This can affect how well your medications work and increase your risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, Be cautious of products that could raise your heart rate or blood pressure, or worsen your heart failure. Always check with your pharmacist before using any new products, especially cough and cold remedies, diet aids, or NSAIDs like ibuprofen or naproxen. If someone has taken too much Tenormin and is showing serious symptoms like fainting or difficulty breathing, it's important to seek emergency help right away. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include a very slow heartbeat, severe dizziness, weakness, fainting, and trouble breathing. It's important not to share Tenormin with others. Making lifestyle changes like stress reduction, exercise, and dietary changes may help the medicine work better for you. Be sure to talk to your doctor or pharmacist about any lifestyle changes that might be helpful for you. Also, make sure to regularly check your blood pressure and heart rate while taking this medication. Learn how to monitor your blood pressure and heart rate at home, and share the results with your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose as usual. Don't take extra to make up for the missed dose. So, when you have Tenormin at home, make sure to store it at room temperature and away from light and moisture. Don't keep it in the bathroom and, of course, keep it away from children and pets. And if you ever need to get rid of it, don't just flush it down the toilet or pour it into a drain. Instead, make sure to properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the right way to do it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.